My name is Rishi Singh from Mass at Mass General Brigham Hospital. The Maestro2 is really valuable for my retina practice for a lot of reasons. First, it's the automation and the robotics. Being able to put a patient in the machine, press a button, and have image acquisition done by the machine itself and not with a technician is a huge advantage over current devices that are available. The other advantage is really doing hanging protocols, being able to put 2 or 3 protocols at once. The machine takes care of the rest, and then the output is wonderful. It's equivalent to everything we've seen on the market so far without any of the fuss. The image quality of the Maestro2 has been phenomenal. We've seen it in practice with really complex retinal patients, sometimes with very difficult pathology to image due to anterior segment abnormalities, and yet it's still able to take a very good image on those patients and really help with our diagnostic capabilities. OCT angiography is the wave of the future for our ophthalmology, especially for retina. And this year, especially with all the new devices coming out, the Maestro2 fits into that realm really nicely. Image acquisition is very unique. It's very easy to use with a user interface to kind of look at segmentation algorithms to see flow patterns. Many advantages over current devices that are available. In many of the places we work in, it's very hard to find skilled people that understand what good OCTs are looking like and should be like. Having automation and really the robotic ability of the Maestro2 has been a huge advantage to our practice to acquire images on a very regular basis for all patients. One of the ways that I use the Maestro2 in my practice is with the wellness exam. It's an easy way of assessing a patient when they come in the door for the first time when they see me. It gets a fundus image, a neurofibrillary OCT, and also a macular scan on a patient. And that can help me easily diagnose the patient instead of having to wait and order additional tests, and really expedites their treatment process. The Maestro2 and pictures of the eye can really be helpful at educating our patients on the process, showing them their pathology, understanding kind of where their diabetes sits right now, how their macular degeneration is responding to therapy has been a huge advantage of this device. I've been very impressed with the TEMPO and its workflow in my practice. One of the big advantages is the binocular capability, being able to do both eyes simultaneously for visual field. The footprint has been impressive, very small compared to what we used to see in visual field devices, and hence its usability in our practice is huge. Patient experience with TEMPO has been amazing. One of the great things about it is because of its binocular device setting, it's easy to use. They're very familiar with kind of that practical way they've also used binoculars in their own lives. The ability for it to be adjusted to their height is very simple, so we can even use it in a patient who might be in a wheelchair, which gives it a lot of accessibility. And I think with the footprint, we're able to do multiple different devices in one room to really prevents a patient from having to move from room to do all these different tests. It's impressive to see the TEMPO outputs. In the visual field world, you're always used to seeing very robust examinations and reports. And with the TEMPO's device and its small footprint, it gives equivalent results to what we've seen with very larger devices. Imaging technology has really been helpful in monitoring our therapeutics to date. And what we're going to see from the future is really a focus on some of our newer generation therapeutics in geographic atrophy and neuroprotection. Topcon has been an amazing partner of our practice. It's helped us really get to seeing patients in a much more efficient fashion. One word to describe Topcon's impact on my practice has been forward thinking. It's been the way that they've been able to look at the future of retina, determine what partnerships they need to develop, and create really robust future techniques and devices for our practices.